This is Dave Covell, Health Commissioner here at Lorain County Public Health. Today we're going to do some COVID-19 vaccine questions and answers with our Medical Director, Dr. Doug McDonald.
Dave, can you tell us a little bit about whether or not the COVID-19 vaccine will be mandatory?
COVID-19 vaccinations will not be mandatory at this point. We do highly recommend you get vaccinated because, again, that's the best way for us to have the protection for our whole community.
Dr. McDonald, can you talk a little bit about the safety of the COVID-19 vaccine?
Sure, Sarah. The COVID-19 vaccine is a safe vaccine. It has undergone all the testing that any other major vaccine would undergo for public distribution. The only difference between this and some of the others that we're familiar with in the past is because of the emergent nature of the pandemic. Some extraordinary things were done by the government to move the process along as quickly as we could while maintaining safety. So all the usual trials with who would actually receive the vaccine, both in the early periods where the initial doses were tested and later on when we had tens of thousands of people receiving the vaccine, all those were done with COVID-19, just as we've done with others. It's just at this time around, the government invested in guaranteeing manufacturing of millions of doses so that the companies that were testing it were actually producing the vaccine at the same time. That allowed us to finish all the safety testing and have it available at this earlier point.
So a little bit more about the side effects. Dr. McDonald, can you talk about what the short-term or acute and the long-term side effects of the vaccine may be?
Well, actually, in many respects, by definition, side effects from a vaccine like this are always considered short-term because that's generally when you experience them. People generally don't have a side effect from this or any other vaccine late. And the kinds of things that people would look for would be not only things you might remember from other vaccines like flu shots where your arm might be sore a little bit, but with this vaccine, because it's stimulating your immune system to respond, you may have almost mild, people can think of it as almost like a little mini mild flu-like symptoms, maybe some body aches, maybe a little fever, maybe feel a little tired, but it should only be for a few days. It's nothing at all like when people actually experience COVID, and it is not COVID. It is just stimulation of your immune system to get ready in case you are exposed to COVID.
Dave, who should get the COVID-19 vaccine and what is kind of the schedule of when we can expect it for us in the community?
So it's important to remember, as vaccine is limited in terms of availability, that we'll start with the highest risk people first. So medical workers who work on the front line, long-term care facilities, and then our EMT workers, our emergency workers who come when you call 911. And so those folks will be vaccinated first. Between now and April 1st, most of those high-risk groups will be vaccinated and be safe. And then we'll start to move into the general population between April and June. It's really important to remember that when you are going to get vaccinated, that you need to get both doses. So you'll get your first vaccine, and then 21 or 28 days later, depending on the vaccine, you'll get your second one. Again, over the next few months, we're planning on vaccinating most of the population when it comes to high-risk people.
Thank you. Anything else to add, Dr. McDonald?
Other than the fact that, again, the focus right now is on making sure that the people that have to take care of COVID patients are protected, and of course our long-term care residents who have been hit the hardest. That is the starting point. And then, as Dave said, we move on and get to the general public eventually.
What is your guidance to people who ask, I was already sick with COVID-19, will I get the vaccine?
Well, it turns out that if you did have COVID-19, you are still eligible and you should receive the vaccine. With COVID-19, again, being a new illness to we humans, it is not clear that having the illness alone provides long-term immunity, and I would not rely on that. As it is, it's only felt that a few months is probably the immunity we have, at least at this point in time. But so having the vaccine is really the best approach right now to working us toward not only having longer immunity, but protecting the entire population. We can't rely on people just getting sick. That creates many problems and leads to too many needless deaths. The vaccine is the answer.
Dr. McDonald, a few more questions on some special populations. Should people with allergies get the vaccine?
You know, when we use the word allergy, most of the time we're talking about people who have seasonal allergies, those types of things, maybe foods, what have you, but usually it's the seasonal things. And there's no issue whatsoever with anyone with common allergies to get the vaccine. It would have no impact on their eligibility or response. The one issue that has come up is people who have had significant allergic responses to vaccines in the past. And as it is still possible to receive this vaccine if you did have that kind of reaction. It is advisable that you have a conversation with your own doctor about it first. And it should also be done in a setting where the person can be observed for about 30 minutes after the shot to make sure that they don't have a reaction. Most vaccine administration locations are set up to be able to provide things like epinephrine, EpiPen, that type of thing if needed. So for people that have had a severe reaction to vaccine, they can get it, but they should have a discussion with their doctor and they should make sure that they're observed for a short period of time.
Finally, what about people who are pregnant or breastfeeding? Should they get the vaccine?
Well, they can get the vaccine. Again, it comes back to, in this case, it comes back to the fact that while there were a few pregnant women in the trials, there weren't many. So we don't have like robust data with respect to pregnancy and this vaccine. But if, again, it's a shared decision that they can have with their obstetric provider. And as long as the patient is willing, they can have it. Just know COVID can be can have significant, impact on pregnant women. So you're always weighing the risk. What's a greater risk? Taking the chance of getting COVID or having a vaccine that protects you? And more likely than not, I think when they have that conversation with the provider, they're going to find out that the vaccine is the better alternative. And that would apply as well to those who are breastfeeding. There's no real data about breastfeeding their infants. So again, it is possible to receive it, but they should have that conversation.
Anything else, Dave, that you want to talk about or touch on when it comes to COVID vaccine?
So I want to thank Dr. McDonald today for answering questions regarding this vaccine. And if you need more information around the COVID vaccine in general, where you may fit in and when it's going to be your turn, or any of the safety information, you can go to our website at loraincountyhealth.com, and there'll be lots more information there. Thanks for joining us.